Is Medicare Advantage worth it? Medicare Advantage plans have been growing in popularity. These plans are completely optional and can really vary in cost, from no additional premium to a couple $100s a month. So why would you choose one of these plans? And what are your alternatives? You probably already know that when you sign up for Medicare, you pay the federal government a monthly premium for Part B and sometimes Part A. You'll still do that with Medicare Advantage, but then the government will pass your premium over to a private insurance company to administer all your benefits. A lot of people like this because they're pretty familiar with how these plans work from their former employer or a plan on the health insurance marketplace. So that makes for a pretty smooth transition into Medicare. Here are some of the other perks with Medicare Advantage. Most Medicare Advantage plans also include Part D drug coverage. So instead of shopping for a separate plan, you can have one less thing to think about and one less card in your wallet. Most Medicare Advantage plans have benefits such as vision and dental coverage, or even perks like gym memberships and digital wellness programs. Most Medicare Advantage plans have physician networks, whether in the form of an HMO, PPO, or EPO. That means you will have the same access to all the doctors in your plan's network as any other member. With the original Medicare, it is up to you to make sure each individual provider that you see takes Medicare, which can be a little additional legwork. And finally, most Medicare Advantage plans have annual out-of-pocket maximums, which means that the plan protects you from spending more than a certain amount each year. You don't have this same protection with original Medicare. Sounds like a pretty good deal, right? It generally is. With Medicare Advantage, you know you'll be getting at least as good of coverage as with original Medicare, but usually much better. So let's talk about the alternatives. If you decide to choose original Medicare instead, you'll want to make sure to also purchase a Medigap policy, or what is also known as Medicare supplemental coverage. Without a Medigap, you could end up with a lot of out-of-pocket costs. Medigap plans do tend to cost more than Medicare Advantage, but the coverage is much better. With Advantage, you will still have some co-pays and co-insurance here and there, but with a good Medigap plan, it's common to have no out-of-pocket costs at all. Just remember that you will need to enroll in a separate Part D plan, because Medigap does not include Part D. So it really boils down to this. If you have a lot of health conditions and anticipate needing a lot of healthcare services, and you can afford it, you are probably better off with a Medigap and standalone Part D plan. If your health is pretty good and you're more budget conscious, Medicare Advantage is probably a better deal for you.
Max Medicare. Get more for your Medicare dollar. Talk to a licensed insurance agent at maxmedicare.com or install the Max Medicare app on your phone.